In virtually every city and town in this province, people are grappling with a substance abuse crisis. Friends, loved ones, classmates, co-workers struggling in terrible ways with addiction, with unsafe supply, with stigma, with pain and desperation. Others feel like helpless bystanders, watching tragedy unfold on their streets and outside their businesses. Tonight's edition of TVO Today Live was recorded at the Algoma Conservatory of Music in Sault Ste. Marie, Ontario. We thank the Wilson Foundation for its generous support of this special series, engaging with live audiences. We could have been in any town in Ontario, and we could have had such a conversation with citizens in any part of this province. We are grateful that the people in the Soo opened their doors to us and that people from across the community talk to us about how they experience this crisis, how it can bring them together, and how it sometimes pushes them apart. As with all of our TVO Today live conversations, our interest is in democracy and how collectively solving our problems isn't just the government's job, it's everyone's. Here now, that conversation. First of all, extremely grateful to all of you for sparing so much of your time for us here in this gorgeous space here on the loft at the Conservatory of Music. And I essentially, over the next hour that we have together, want to explore three different things. I want to find out how you experience this crisis in your either daily professional lives, personal lives, whatever. I want to find out what's helping, and I want to find out what's still needed. So that's the roadmap for the conversation we're about to have. And Hillary Gordon, you must have drawn the short straw, because I'm going to start with you. You're with Algoma Public Health, and why don't you tackle that first part there? How do you, in your professional life, experience this issue?
Yeah, that's a great question. And I would say in my professional life, thinking about our public's health, it's very heavy. And of course, I'm thinking about the surveillance that we look at and report on all the time, the number of opioid toxicity, mortalities, emergency department visits, hospitalizations, EMS calls, and those numbers are quite high here in Algoma and also in the north. And this is really the tip of the iceberg. And I think I experienced this knowing that the depth of human suffering that we experience is so much greater than those numbers that we see. And the numbers themselves are stark. So thinking about the non-medical factors that really influence our health, such as the social determinants of health. And with this issue being situated in the north, access to services, the simple presence of services, because we're the north, our health disparities are greater compared to some southern communities. So I think of the complexities that we all face together and the layers upon layers that people have to navigate in order to get well across multiple sectors. So
Thanks for getting us started, Hillary. That's great. Jake, you've got a microphone there. Jake Rendell, who are you here representing today?
Well, I'm the owner of Cases Music. We are a small music store and school in downtown Sault Ste. Marie.
And how does this issue appear on your doorstep, or not every now and then?
Well, right now in the downtown, a lot of us know it's not great. It's very present. We have kind of a front row seat of a lot of mental health and addiction issues. And as a business owner and a downtown business owner that's trying to showcase all the positivity that's going on downtown and really trying to bring it up, it's hard when it's so prevalent every day, and we feel like we've lost a lot of the community trust and support. People have a really negative view of downtown right now because it's the only thing that they see is...
Can you just tell us about that? You say it's so prevalent every day. If you're at the front door of your music shop, what are you seeing?
I see a drastic drop in people walking, especially in the wintertime. The people that do tend to be out on the street during the day are usually people that are struggling with addiction issues or with mental health issues. I see ambulances drive by pretty regularly. I see our Downtown Ambassador program, which is awesome, helping people that are in need. But it's right now often one of the first images that people tend to associate with the downtown is, the struggles that we're having. And as a business owner, who wants to have compassion and tries to help and tries to donate and tries to find ways of making it better, it's also a huge struggle because, you know, if something happens, if someone comes into your store or if something's happening on the street, your first thought is not about that person. It's about protecting your staff. It's about protecting your clientele. You know, we're a school for kids. We have, at any time, there might be 50 children in our building, and that they're my priority, which is, it's a very conflicting stance.
You mentioned downtown ambassadors, and we've got a couple of them here, so maybe this is a good time to hear from them. Hillary, could you pass the mic to downtown ambassador Amy? Amy,
Steve.
how do you experience this?
So I am a downtown ambassador.
Why don't you tell us what that is, first of all?
So I work with CMHA, which is Canadian Mental Health Association. And my role is a peer support worker. So usually we hire people with lived experience with either mental health, addictions, both, people who have family members that are affected by either of those. And the Downtown Ambassador Program. So we go out 7 days of the week. Monday to Friday, we're 3 to 7. And during the weekend, it's 10 to 6.
And what are you trying to do?
We just try and help the community as much as possible. We don't have a select group that we are there to help, but a lot of the people that we encounter in the downtown core are people who live with mental health, people that live with addictions. We're advocates for harm reduction supplies, harm reduction programs, try and connect them with as many resources as we have. It is difficult, especially with the times that we go out. A lot of organizations are closed, so we kind of bridge the gap there, and we help as many as we can.
Your friend Taylor's here. She's a downtown ambassador as well. Got a microphone there? Good. Why don't you pick up on that and tell us how you see this?
For the Downtown Ambassador Program, it's honestly a really interesting job to have. You see a lot of different people in different areas of like struggling and need. Sometimes you'll see people who are like, oh, like, what are you doing? Like, what is this? And they'll still end up asking for supplies or something, but like they have, they're struggling with addictions, but they are still kind of seeking us out because they either heard from us, from a friend, or other organizations.
Taylor, can I ask how old you are?
I'm 26.
26.
Yes.
If you see somebody who's clearly in trouble, I mean, I'm a little older than you. Mm-hmm. I will confess I might be scared to get involved. How are you not afraid?
I definitely get a little afraid. I get nervous. I get just because you don't know what's going to happen exactly, but most of the time, like 99% of the time, when there's something going on, it's probably a life or death situation, especially when it's like an overdose, and kind of just got to override that fear and just put the person's best interest at the forefront, their safety, their health, all at the forefront of what we're doing.
And another follow-up. Some of us here are a little older than you. As I pointed out, we've developed a little more scar tissue over the years. Mm-hmm. So maybe we are sort of a little more resilient in dealing with some of this stuff. How does this not affect you personally when you see all this?
It definitely affects me, but I don't say it's like jaded me necessarily. If anything, I find myself even wanting to help people when I'm not on the clock. I call the other downtown ambassadors when I'm not working and I see something going on. They're the first people I call.
Gotcha. Mike Nadeau is here. Mike and I know each other a little bit because we did a conference together at the Association of Municipalities of Ontario, AMO, in Toronto. You're the CEO of the District of Sault Ste. Marie Social Services Administration Board. Homelessness is something, in your profession, you see way too much of. How do you encounter this issue?
Well, welcome to Sault Ste. Marie,
Thank
Steve,
you.
and it's nice to see you again. Unfortunately, homelessness is an issue that our agency is dealing with en masse, and it's directly attributable to the increase in opioids and addiction rates across the community. Our organization is responsible to ensure that shelters are adequately funded. We're also responsible to ensure there's affordable housing. We deliver income assistance to folks. Quite frankly, the services and the resources that are available to our organization to meet the community's needs are wholly inadequate. We need more shelter space. We need more affordable housing. 20 years ago, when our organization was first formed, we were responsible to provide affordable housing. So now over the last 5 years, we've really found that we've had to shift. The demand is for supportive housing. Folks do not have the ability or the capacity, unfortunately, to live independently oftentimes. So we need to make sure that there's 24-hour supports available for people. The healthcare system, even though it is trying, it needs significant investment to be able to meet the demand. So we're finding that we're trying to bridge the gap between housing and health-related services. Also, another struggle that we're seeing is Ontario Works rates. They're less than $750 a month for a single person.
This is essentially Ontario's welfare program.
Yes. There is no way without rent assistance that someone can find an apartment or a house for the rates that are available. So we look at it broadly as a system perspective. We're brought in across the community. We have outreach workers. We fund CMHA to run the shelter. We have invested millions of dollars in capital and millions of dollars into the system, and we're still finding that we could use probably a 3 or 4-fold increase to meet demand.
Pass the mic, if you would, to your friend Nathan here. Nathan Mondor's an alcohol and drug prevention worker with Indigenous Friendship Centre. This issue looks even worse through an Indigenous lens, if I can put it that way. Pick the mic up nice and snug and tell us what it looks like from your vantage point.
So first off, thank you for coming and being here and having this conversation. And you're 100% correct. It does look a lot worse from an Indigenous perspective, especially like in our homeland, watching like the heart of our communities, watching the majority of people who are on the street and displaced, facing mental health and addiction issues, being predominantly Indigenous. The services just aren't here. We deal with issues downtown, as Jake said, but the fact of the matter is the majority of our services where people are getting help are downtown. And it's a very unwelcoming place. It breeds in the stigma and the shame of being here when most of these people are from here. They know this water. It's where they're supposed to be able to come and go freely, and they can't even afford anything. There's nothing there. There's nothing here for us in regards to support or any cultural basis for healing.
Nathan, when you see it, do you sometimes think this is a problem that just cannot be solved? It's beyond our means to solve it.
Yeah, unfortunately, yeah, I
You're
do.
there.
I wish there's more I could do. Like, it's not meaning that I'm going to stop doing my work and stop doing my job, but there's moments where it's like a gray cloud, because it's every step we take forward. It's like you get to that finish line and the finish line's not actually there. It's like that mirage. There's such a sore lack of support for rehabilitation and treatment, where people come in and they want treatment, they want help. And you're like, yeah, let's do that. And you go and you apply to like 6 different treatment centers, and then you don't hear anything for 8 months. Or it's like, oh, they're on the waiting list. Well, how long's the waiting list? 6 to 8 months, if not longer. And then you hear words that like, oh, if you have $20,000 cash, you can get in first. Like, you could be in tomorrow.
Let me guess, many of your clients don't have that kind of money.
No, none of us have that kind of money. Like, there's a huge class disparity between mental health and addictions treatment as well. It's like, if you have to go through OHIP or any like medical funding, you're bottom of the list, you're waiting for a bed. But if you got a pocket full of money, you can get your help. And treatment is not the problem. Well, you get people into treatment as well, and then they come back, they come home, and you can literally watch them just fall back into it. I'd say there's about a probably 60, maybe 70% chance that you get someone to treatment, they come home, they've gotten everything they've needed, they're doing good, and within 3 months they're either back on or they're dead. The rate is ridiculous of relapsing because there's nothing here.
We have some people here, I see some purple t-shirts in the back here, from a group called SOYA, Save Our Young Adults. Connie Rayner Elliott is the founder and president of SOYA. Tell us about this group, Connie. What do you do?
Yeah, I'm actually the founder of Soya. We've been around we just celebrated 13 years. We actually are we live in the downtown core. We run a depot. And my dream is to close Soya, that we don't need us anymore. Unfortunately, the demands are getting a lot bigger. We service approximately 500 people a week. And I totally agree. I mean, I could give you lists and lists. Somebody comes for help and it's just like, Connie, I'm ready. And then, I contact Northway Wellness and it's just like, well, there's a waiting list. I do transport a lot of people out of town, unfortunately. And then if we do get somebody to treatment after months, we need safe beds. Like, where do they go? They finish detoxing, right? It's just like, okay, you finished your detoxing, and then it's like, well, there's no place for you. So they go put back on the streets. Our highest rate of losing people is in that transition. Then we finally get them to treatment, okay? They go to treatment, they come back to the same stuff, okay? We need more housing, we need more services. We have come a long way. In the last 2 years, from when I started Soya, like now we have the new CRC. This new CRC,
What's
that's the Community Resource Center. It's amazing. But we have 22 beds on the bridge side, 22 shelter beds. Okay, and that's actually one of our warming stations. Okay, we have Pauline's Place. Okay, that's the place for women and children. The warming station there is 5 beds. Not 5 beds, 5 chairs. Okay, 5 chairs in the lobby. I watch people struggle day to day. I do work full time. I'm not just Soya. We are blessed with amazing community partners. Okay, we do everything. We're talking. If you need help with housing, we'll help you fill out your forms. Okay, if you need mental health support, okay, we refer. That's our main thing because we have amazing organizations in our city, but we refer.
Connie, forgive the question. How do you keep your sanity amidst seeing so much misery?
I'm going to be honest with you. I really believe this is a calling. Okay, I think God put me here for this reason. Unfortunately, I have lost my stepson to substance use disorder. I have a son that's in recovery, and I count the wins, right? The ones that we keep going. Our mandate is to save lives. And saving life is to me, get proper housing, get proper mental health. Okay, if you have substance use disorder, let's get them the help they need. You're hungry. Like the food insecurity, not just in our city, everywhere is huge. Okay, and then, the whole thing is, like, we're basically the hub. Like, we're a miniature hub. And I'm going to be honest, when it comes to mental health and substance use disorder, unless you're having a breakdown between Monday and Friday, like, don't have it after 10 o'clock. It's very challenging to get help. And everybody here knows that. Okay. On holidays, like, I'm going to be honest, I'm totally disappointed. Between Christmas and New Year's, we lose so many services in our city. And I understand, because it's staff related. Canadian Mental Health, you're open for, you're open. Okay. The CRC is open. Okay. But all of a sudden, on Christmas Day, okay, people still need to eat. People still need that help. And we're losing, we were losing our 30 generation. We're moving on to our 20s. Okay, we are losing generations and generations of people, and we need to do something really quick.
Connie, pass the mic to your friend sitting beside you, also with a purple T-shirt. That's Monique Cowan. You're
Yes.
also with Soya.
I am.
Monique, tell us about what you do.
What do? I volunteer at the depot. I'm a team lead. So I also, I help stock the depot. So I'm in charge of ordering and picking up items that we need for the depot. During the week, we're open Tuesday, Thursday from 11 till 2, Saturday from 11 till 3.
Okay, but tell me, you are all obviously involved in doing a lot of good works, trying to make some progress against a very persistent, difficult problem. Are there days where you just think to yourself, I'm spitting into a hurricane here?
It happens, I'm sure, often enough where you'd think, I'm going to throw in the towel, but we never do. We would never do that. I could never do that. My daughter suffers from substance abuse disorder and mental health.
How old is she?
She's 31.
How did it start?
It started as a teenager, and then it progressed from there. But over the last 5 years, she's been homeless. So actually, Soya saved me because originally I started just going to garage sales, bringing in items to help because everything there is given out free. On Saturdays, we're a food bank, and we give away free clothing, free household items, stuff like that. So,
Monique, I don't mean to, I don't mean to infringe on your privacy here.
Yeah.
But sharing your experience might be very helpful to our better understanding what's going on. You say your daughter's homeless right now.
yes,
Why is she homeless?
she's homeless because we've had her stay at the house. So she did go to treatment. She went to treatment 3 times. Treatment isn't always what they present to you. It's what you take and then you go forward with. So she's suffered a lot of trauma as a child, which I wasn't aware of until. So
But
for
she
her,
can't stay with you right now because
because it's dangerous
for
us.
because
Because she's unpredictable. She's not well. Things have happened where it's been quite scary for us. So for her, it's safer for her to be, in a safer place. But we can't get there today. But we're still working on it. We still see her. We still try to help her, but we have set our boundaries.
Gotcha. I'm going to ask Ambassador Amy to pass the microphone behind her to Emily Giovanoli.
Hi.
And you're with Soya as well.
I was volunteering there, yes.
Okay.
But I currently work at Canadian Mental Health.
Okay. Tell us what got you into this.
I'm a recovering addict. Obviously, my drug of choice was opiates, more specifically fentanyl and crack cocaine. Connie from Soya played a huge part in my recovery. I found it very difficult to find services for myself, my family. I'm very lucky I have a very supportive family that stuck by me. Just like Monique, though, I wasn't allowed to stay with them. I was also homeless because I was a danger to them and myself.
I look at you now and I think, how could this person possibly have been a danger to anybody? You seem like perfect. How old are you?
26.
When did you first have a problem with this issue?
19.
At age 19?
Yeah.
How did it start?
I got in with the wrong crowd, a bad boyfriend, and that was that.
Were you homeless at some point?
Yes.
So you got kicked out?
Oh, yeah. I ended up moving to Toronto, and that's where my addiction started. And I came back here, and it just worsened.
Home is here?
Yeah.
And it got worse when you came home.
Yeah, the hopes were for me to leave him and come back and get clean, which I did for a while, but eventually I, found the same people and birds of a feather flock together, and I was in active addiction, so, that was my crowd at the time.
How long are you drug-free now?
Yeah.
For how long?
A year.
Why do you think it's working right now?
I had my son. He saved my life.
Okay. How old's he?
He just turned 13 months.
Lovely. It's funny. It's funny how mothers always refer to months.
Yeah, I know. It is.
I'm 945 months old, according to my folks. Yeah. Okay. How do you like your chances for staying drug-free?
For myself, I think it's pretty good, but I can't speak for others. Not everybody's as lucky as I was. I have a beautiful family, a beautiful boy. I have very supportive family. A lot of people don't. And for those who don't, their chances are much lower. It's very difficult to navigate any sort of system, get any sort of assistance when you are in active addiction. I had no idea that any of these services even existed if it wasn't for Connie and my mom. So for myself, I don't have any cravings and I have a beautiful boy to look after, and that's all that's what makes me go forward.
And you got a bunch of people here in your corner cheering for you.
Yeah, exactly.
No doubt about it.
And I just hope to advocate for others in that situation. So, yeah.
Thank you, Emily. Jake, can you hand the microphone to Ali? Oh, you've got a microphone already. There you go. You're the CEO of Algoma Family Services, Ali Juma, including the Youth Wellness Hub. Is that right?
Correct.
What are you up to these days?
Well, we're up to a lot, but first of all, Steve, like others, I want to say thank you for being here and covering this story. It's a needed story to be told. I think what you hear about not only the challenges, but as you wrap your time up here, hopefully you'll leave with a sense of really what we're doing. And the Youth Hub is a great example of that. You know, we opened this youth hub in January of this year with the idea of making it an easy place to get the help that you need. And we opened it right in the downtown core, right across from the bus depot.
How much did it cost to get it going?
Well, it cost quite a bit, about $350,000 plus $180,000 to buy the place.
Where'd you get the money?
From a lot of different sources. The City of Sault Ste. Marie committed $100,000. Youth Wellness Hubs Ontario committed $100,000, and some of our community partners, the Canadian Mental Health Association, provided $50,000. The DSAB helped us, and also Algoma Family Services.
Is it working?
Well, I would say so. When we opened up in January, our numbers were about 200 in February, 300 in March, and we had over 400 youth in April alone. And so when you think about that, Steve, where would these youth be otherwise? This hub is for youth 12 to 26 years of age. And it's a great place because we want to create a safe, welcoming, and inclusive environment. You don't have to receive service, but you can be there and you can connect. So you might be familiar with Dr. Gabor Mate. He's a famous researcher who really talked about addictions being an affliction of the disconnected. And what we hope to do with this hub is to connect youth so that they can connect with each other, find a connection to community, find help in one place. The hub model is not new. It's been around for some time.
So if it's a hub, what multitude of services are you offering?
Well, a number of services. We do have from Ontario Works, we have the Indigenous Friendship Center there. We have Children's Aid Society, we have Algoma Public Health, we have a nurse practitioner, we have the John Howard Society. So there's many employment solutions. There's many opportunities for young people to connect to these services, to find a link to whether it's finding a home, finding a job, needing health through our nurse practitioner. You may have heard we've had a primary care challenge in our community, and so for our young people, there's actually access to that.
Does it cost anything for the young people to avail themselves of this?
No, not at all. In fact, it's absolutely free. The idea was to really create a low barrier access to these types of services, and that youth could actually leave with more than what they came in with. So they can leave with a bus pass. There's a shower facility there. There's also the capacity to do laundry. We have hygiene products that they can leave with. Some of these young people are carrying what they have around in a garbage bag. So they can come and get some of an actually better bag, but also leave with some really important knowledge about what's available, but also more tangible things like hygiene products that they might not otherwise have.
Is it incumbent upon them to take the first step?
Yes and no. I mean, we've created a very safe space. A space where they can hang out, they can access the internet, they can connect with each other. We've got, video games, ping pong table, pool table. We have food, warm food that they can have. And then through that, we have what we call peer navigators who can connect with the young people, learn more about what's happening with them, and connect them to those services. So it is important for them to actually take the first step to come to our hub. But, we've got great partners like Soya, who's there providing service every Friday night. They're doing meals for young people and helping spread the word about this hub.
Great. Okay, Jake, now I will ask you to pass the mic, if you would, to Katie Kirkham, who is paramedic, Chief District, Sault Ste. Marie. How do you engage with this problem?
Thank you very much, Steve. Appreciate you coming here. I think what we've noticed in the paramedic service is the changing types of emergency calls that we're seeing, and it has increased over the last few years. Opioid overdoses, addictions, mental health problems. And I think the biggest struggle for us is knowing exactly what we can do at the time of the emergency. Paramedics are used to fixing the problem when they're faced with one, or they're used to taking it to somewhere else where the problem can be fixed. This is a problem that you can't fix. And not, at least not in the acute stage of the emergency. And so we're really trying to wrap our heads around what can we do at the time, who can we connect these people that need resources to, and how do we make an improvement in these problems? Working under the broader organization of the DSAB, we've found that we're able to connect with other areas of the DSAB so that we can try to
DSAB is what?
social services, Mike Nadeau, and it's a great organization to be a part of as a paramedic service because it is leading us to connecting with the kind of resources that we need to be in touch with at the time of the emergency. So I would say that's our focus now, is to really get plans in place so that we can deal with the problem at the time, and hopefully help in some way other than a traditional way of taking them to the hospital.
But I presume that your people are dealing with everything from heart attacks to somebody breaks their leg playing hockey to, right? I mean, you've got
That's right.
everything in the kitchen sink that you're dealing with.
That's right.
So what percentage of what you have to respond to is what we're talking about here now?
I would say that mental health addictions and opioid overdoses is about 30%, all wrapped in under that number. It's a number that has been growing, and quite honestly, it caught us by surprise initially. Because we were so used to dealing with medical problems or traumatic injuries, and this is something new.
Okay, Emily, you want to pass the mic there to Sarah Skagen, who's a music teacher and an interested citizen. We like interested citizens. How do you encounter this issue?
Well, for me, it actually started during COVID. I live in Steelton, so there are a lot of transient people in my neighborhood. And because we were socially isolated, I made a point to connect with every person that was on my street. So if they were walking by, I said, hello, how's your day? Some people would stop and talk for 15 minutes. Some wouldn't acknowledge me at all. But what surprised me was that people who were in active addiction often didn't even want to raise their heads. They felt so much shame that somebody just acknowledging them was overwhelming. So after a few times of me consistently reaching out to these people and saying hello, they started to respond. And in a lot of cases, they would ask like, hey, do you have a bottle of water? And I started keeping like stuff to make peanut butter and jam sandwiches in my garage. Just like, are you hungry? Can I help you? Because a lot of the services were closed. From there, I took the mental health and addictions program at CTS Community Career College because I just felt like I needed more information. I needed to know how I could be part of the problem instead of part of the solution.
Other way around.
Yes, thank you.
Yes.
Part of the solution instead of part of the problem. But it just seems like the people who are doing the work often don't have time to respond to the people who are perpetuating the negativity that surrounds addiction and mental health. We have to always remember that these are people that are struggling with a substance use disorder. The person comes before the disorder. These are people with real stories, and they don't actually have control over the things that they're trying to manage. And while it affects our businesses and while it affects our resources, I think as community members, if we just practice a little compassion, it could teach us a lot, and it would actually help the people who are suffering a lot more as well.
Okay. I appreciate the whole issue around stigma. This is tough, right? I mean, nobody wants to be thought of as being the helpless addict in a community. What do we do about that? Is there anything? I mean, you say you're really marvelous, leading by example here as an interested citizen. Let me hear from you on that, and then Mike, maybe pass the microphone to Nathan. We'll hear from him as well.
So it's actually really interesting because once you get into the conversations with people who are struggling, you learn a lot. I'm a former employee of the Downtown Association, and one day I was actually walking down the sidewalk and had somebody who was homeless give me a bunch of flowers and just wished me a good day. So in my travels, I continued and was saying hello to people and just chatting. And somebody said, I really like your flowers. I said, it was really strange. Somebody just handed them to me on the street. I thought it was really weird. And there was a lady who was clearly in active addiction and her head was down. And she said, that's community, sister. That's not weird. And I went, thank you. You taught me something today. So I feel like if we just take the time to listen to other people, it makes a big difference in our entire community, period.
Beautiful. Nathan.
So That's a huge part of what I was going to say is having people being part of the community is a huge thing, and not having them, it just being like a move along, you can't stay here, giving them a stake in where they're at. There's been multiple projects that have been happening in Ontario that seem to have some success. One of them was done in Peterborough with these, they turned shipping crates into like tiny homes essentially. And there's the other tiny home projects where these people are coming in, they're able to actually have a place to go. They're able to have something to be proud of, something to be a part of the community. And from what I've seen in the return, these people are actually being able to get like stand back up and be able to go back and work through whatever it is that they're working through to be a part of the community, instead of just, having nothing to do, not being a part of it. And honestly, people need to start giving more of a chance, more of a supporting hand, and realizing that that person that has their head hung low, that's pushing a shopping cart, whatever it is that they're doing, that it's not just as simple as going and getting a job, realizing that they can be, and you can be too poor to get a job, that you don't have a phone number, you don't have an address, you don't have your ID. Having people take that step when they go, hey, I want a job, I want to do something, giving them an actual chance. And it's something that we face drastically in our organizations, where there's people are trying to get better and trying to recover, and people don't want to hire them because they're in recovery, which just perpetuates the cycle. So
We need to give an award to Nicholas Luck because he is the most patient person here today. He is the only guy who hasn't spoken yet. He's with the Sault Ste. Marie Downtown Association. Nicholas, what brings you to this conversation?
Well, thank you, Stephen. What brings me to this conversation? Well, we do see in our downtowns across Ontario, a lot of the crises we're facing, even outside of this issue, is rearing its head in our downtowns, right? I mean, that's typically, abstractly, that's the heart of your community, right? And the substance use and homelessness is definitely a symptom of a greater systemic problem happening in our society, since World War II. But in terms of the BIA and Downtown Association, we definitely saw a lot of issues related to substance use, homelessness, mental health around 2020, because a lot of people were at home, and businesses could only be open, curbside, et cetera.
It's because of COVID, obviously.
Because of COVID. Yeah. But we've never really seen an improvement. I'm on the Community Advisory Board. So many folks from Canadian Mental Health Association and from DSAB are on that committee. And, they're telling me, there's more and more people entering shelter. And, all these folks end up in the downtown. The only place in the city that's really accessible, walkable, is the downtown. If you're homeless, you don't have a car. And most of Canadian cities are not accessible, by walking, or it's difficult. Some cities are better than others. So, and the way we've developed our city, in many cities across Canada, sprawl, endless growth, but not for long-term gain. The way we've developed, a lot of the services ended up in our downtowns.
Yeah. So can I ask you the blunt question?
Yes.
Do business people think, this is really bad for my business, seeing this much misery around?
It is. And it's in municipalities' best interest for their downtowns to be thriving. At one point, when we built strong towns, they were our economic engines of our cities. And then we built out incrementally, right? So with that, we're in this position where I would say not all mistakes from the way we've developed after World War II, we've kind of created this system where we have all of our services in the downtown. Now municipalities are realizing, downtowns are important, how are we going to fiscally survive?
Who wants to speak to this? This notion that on the one hand, the services are downtown, therefore that's why a lot of people who are struggling are downtown. But on the other hand, it's the sort of economic backbone of the city as well. And without a vibrant downtown, you're in trouble in that way. Who wants to be brave enough to speak to that?
I'll speak to something else.
Take the microphone from Ali, if you would. Go ahead.
I totally understand what he's saying, okay, but I'm going to let everybody know, not in my backyard, okay? Nobody wants it in their backyard, and it's not just downtown. I mean, even when we had the Verde in Jamestown, it was in James. It's everywhere. Go to Whitefish Island, go anywhere, okay? Homelessness is across the city. Yes, we do have most of our services that are downtown, okay? But we do have, okay, when it comes to Northway Wellness, okay, that's coming on Great Northern Road. We ended up with the CRC, okay, that's going east. Okay.
So not downtown, in other words.
It's not always downtown. And the thing that I find disturbing, I'm going to be completely honest with you, is these are human beings, okay? I don't know about any of you, but did anyone go to the bathroom today? Okay. Unfortunately, there's no place where our homeless, okay, can go to the restroom. Okay, it's a human need. You need to go to the restroom. And like all of our downtown, I get it, why people are locking their doors. I totally understand it. But I mean, the stigma and like the same, not in my backyard. We are trying to, like, bring up our downtown's beautiful, the downtown plaza. Okay, that was a multi-million-dollar. It's beautiful. I think if people were a little bit more kinder, because it's really sad, because I'm on the west end of the downtown, and it's really heartbreaking when I have people come into Soy and they couldn't even go to the bathroom anywhere.
Mike, come on in.
On the downtown and just that philosophical question that you asked, I'm looking at this. I do believe that the homelessness crisis, the mental health addiction crisis we have, is also an economic development opportunity if we really look at it holistically. In order to address the crisis that we're having, we need more resources to come in, and there's going to be jobs that are going to be created. I think if we can try to figure this out as a community and really do it in a good way, downtowns will thrive, people will get better, and we can have an economic advantage across.
How do you get from here to there?
That's the million-dollar question that nobody is able to figure out. I think it starts by having panels like this where we actually sit down and we talk. The question won't come from, the solution won't come from Queen's Park, or Ottawa. It's going to have to come from the city of Sault Ste. Marie, the citizenship. And I think if we start to look at it from that perspective and get working groups and really get serious about how do we solve this as a community, we will start to make some gains and traction. Right now, I do believe, I know Connie's been doing this for 13 years, but the crisis that we had, the acuity level, it's since the pandemic. So it's really, really fresh, and people are looking for solutions. I think we need strong leadership. I won't get into some of the things the municipality, I believe, needs to do, but I do believe there's an opportunity, and it's going to take all of us working in partnership. We have to set the goal and really start to get committed as a community. Or else we can just sit around and talk about the problems that we're having and not really tackling it. So Iceland had an underage drinking problem at one time. They started to rally. They've addressed some of that drinking problem. I do believe as a community the solutions are here. They're not going to come from Mike Nadeau. They can come from a collective of the population.
I think Hillary's got an idea. You want to pass the mic to her? Over to you, Hillary.
Yeah, just on this piece about stigma and building off of what a couple other speakers were saying. And I think that one thing that we should mention here is the power of storytelling, especially from the voices of people with lived and living experiences. And we know that this is such a powerful way to enact change, but also to humanize this issue. And we've had some conversation here about housing and affordable housing and the need for people to be housed. And that's absolutely important and relevant here. One thing that I want to say is that with opioids and toxic drugs, it affects people of all kinds, and it's not just people who are homeless, and it's really across sectors and classes and socioeconomic status that we're seeing the burdens of these harms. And this is where I think that on that note of stigma, the voices of people who are experiencing this, maybe it's someone in their family, but they are humanizing the issue and helping at that greater level of community understanding. And to Mike's point about moving forward as a community, when we all have that deep compassion and understanding that it can affect anybody.
Emily.
I think it kind of angers me quite a bit when it comes to stigma. I mean, unless you have truly experienced the horrors of addiction, unless you have a family member, friend, or you even know what is going on in that person's life, you really shouldn't have anything bad to say. I mean, people are always constantly judging, oh, this person's ruining this, blah, blah. You know what I mean? All these transient people. Well, what about them? Do you have any idea what they go through on a daily basis, the way they're treated, like the emotional trauma, the childhood trauma, anything that, like, maybe stop and think what has brought them to this point in their life? How did they get here? How can we help? Rather than, they're destroying the downtown, or homeless, or sleeping in my doorstep. Like, why don't you think of a solution then? If you know what I mean? I always find it's the people that are judging most that never have a solution.
Jake.
So, at risk of sounding like a bad guy, I first just want to say I love all of you people. You are. There is no, and it's okay. I'm like, I will put myself on that. There are so many amazing things that all of you are doing in this community, and it is heartbreaking to watch all of this go down. On the business side of things, a lot of our small businesses are barely recovering after COVID. They're barely recovering after all of the economic downfall that we've seen. And, I don't want to justify the stigma. I've gone through and I've tried to show compassion to different people, and it's bitten me on more than one occasion.
Explain, Jake. What does that mean?
Well, so we've got a lounge set up. We've got water and we've got chips. And if anybody comes in, of course, have a sit down, have a relax. Here's a bottle of water. Like, it's a very inviting space, and we don't judge anybody because, frankly, it's a music store and most musicians are dirtbags, anyways. But sorry, tension break. So I've given lots of people lots of opportunities and lots of grace to come in and just sit, and even if it's just to sit for 5 minutes and warm up and have a bite to eat. And I've then had those same people turn around and take advantage, turn around and threaten staff and make customers feel unwelcome. And it has had an impact on the business, and it's...
Meaning customers stay away?
Well, yeah, people don't feel safe going downtown, right. Which I don't blame them for. It is not something that the business owners have the ability to fight. It's not something that the business owners have the funds to put in safety and security measures. It's not something that, when we can say 1,000 amazing things and put it all over social media, and that one negative thing that you say explodes way more than anything positive. And that's just the nature of social media. It's really unfortunate that it's always the negative that gets all the publicity. So yeah, we're frustrated. And it's...
How much of your life savings have you got wrapped up in that business?
We're not going to talk about that, Steve. No, it's, we just went through an ownership transition. We just bought our building. It cost me $750,000 to do everything that I have set up. And if the community loses faith in the downtown, we've lost everything. Now,
so you are feeling quite vulnerable as well.
Yes. That is not to say that I couldn't even imagine to fathom what the people on the street are going through. I don't want to take anything away from that at all. But when we're already in a crisis with the economy the way it is and the downtown the way it is, we can't think beyond our front door. And that's why people are frustrated.
Okay. We've heard a lot of really neat ideas about things that are going on that all of you are engaged in to try to improve this situation. I'd like in our remaining time here now to just hear about what still needs doing. What do you still need? What do you want to see? Funding. Okay, pass the mic if you would, Ali. Funding from whom for what?
Funding from our provincial and federal government
For?
for healthcare and substance use disorder. I mean, the feds are actually going to be cutting back on our homeless. Like, seriously, like, we need more help, not less. So, but we need more funding. Like I said, we have great things. Like North Bay Wellness opened up. The youth hub, love that place. Make the connections with the youth. Catch them while they're young. You know. And like, I mean, the relationships are amazing, and the services there. The CRC, like they actually, like 22 people are off the street because of that, right? But we need more funding. Like there needs to be more help. And the ambassador program. I love the ambassador program. And I totally get where you're coming from the fear. Like, I mean, I work on Gore, and I don't take it the wrong way, but I mean, I'm downtown all the time, and it's like, it can be, I don't fear for myself, but I have those relationships. I have those relationships with people, and I'm pretty lucky about that. But no, I get where you're coming from.
Taylor, do you want to add something? If you would, yeah.
So I work with a lot of different programs. I'm also with the Youth Hub. I do the Downtown Ambassador program. And then on the weekends, I also work at a business, which is in the downtown core.
You're a busy person.
Yes, I am a very busy person. But something I've noticed a lot with like criticisms like that the Youth Hub might get specifically is that we are where we're located. But a lot of the people making those criticisms about it being right downtown across the street from the bus terminal, they don't come downtown anyways. They don't bring their kids downtown. Their kids aren't in activities that are located downtown, and they're the only ones who complain about it being downtown. The other kids that, like, we actually are there to help, the ones struggling, the ones that just need some peer guidance, they come to us. Their parents bring them there. We'll get them a cab there. It's actually a really, really awesome, amazing space. And a lot of the flack and criticisms it gets, I don't think, come from a place of understanding or from people who want to understand.
Okay. Amy, you've got the mic. You're a downtown ambassador. How many are there of you, downtown ambassadors?
I'm not even too sure. So the peer program, we're spread out. So we're in the hospital as peer navigators. We're at the youth hub. We're in the shelter system, downtown ambassadors. So I believe that there's close to 20 of us.
Is it a paying gig?
Yes.
And how many would you like to have?
We could use a whole lot more.
You got 20, you could use how many?
50, yeah. 50 would definitely help. I mean, I don't think we can put a cap on that number to say like how much help that we could do.
Because the need is there.
Yeah. And as far as like what we could be doing, and I find that this community has started it, especially with the Youth Hub, the Community Resource Center, is bringing agencies together, collaborating, breaking down the silos, making it more accessible for people to just walk off the street and have all of the resources available to them in one spot.
Mike, what do you want to see?
Very quickly, we have around 1,500 individuals on our affordable housing wait list. We need about another 90, at least 90 24/7 supportive housing beds in the community. There, in our last point in time count, there was 250 people that we identified as homeless. 67% of that population identified as Indigenous. We need Indigenous-based supportive housing as well. So we need housing, and housing with supports. Finally, there is no treatment option like we're talking about locally. We have a detox center where people can go and medically withdraw for 14 or 30 days. After that, then they're put back into the environment that they came from. So we need more housing and we need more healthcare supports, in my opinion.
Emily, what do you want to see?
I'd just like to correct you on one thing. It's 7 days, the detox center, and I've been there. The issue with that is that, well, first of all, I'd like to say we need funding for some sort of treatment center that's longer than 30 days. 30 days is not enough time for you to get clean, learn new life skills. And
What do
be
you
put
need?
back
How
on
much
the street.
time?
I'd say like 120 days.
4 months.
Yeah. Yeah, even longer. There's a year program out there. I know that in Windsor. But in the Sioux, we need one at least 90 days long. And we need something to bridge the gap between detox and treatment. When I went to treatment, first of all, I had to start off at detox. At this time, I was homeless. So sure, I finished my 7 days in detox, go through all the withdrawals off of everything. And then where do I go? Because the waiting list for the treatment center is 4 months. It was longer during COVID. It was about a year wait for some of them. And not to just to add that only 2 of them are smoking, the rest are non-smoking. You know, someone withdrawing off of hardcore opiates, you got to let me have something. Like, come on, you know? So there needs to be something to bridge the gap between the detox and the treatment center, because these people just go right back to the street, and then the overdose rate is even higher.
Katie.
That's perfect segue, because I just wanted to say something about the gap between the healthcare and social services arena. That's where people are falling through the cracks. That's where we need the funding. Homelessness causes health issues. Health issues lead to homelessness. Opioid addictions and mental health issues are all exacerbated by healthcare crises and lack of supports. So we absolutely do need the funding, and we can't stress that enough. And it's from all areas. It's all, across all social service areas, all healthcare issues. We're just barely keeping our heads above water.
So do you think it would be fair to say that maybe we need better supports for the support workers as well? Because I feel like there's maybe a level of burnout that's happening for probably a lot of people that you work with, and probably for you as well, right? So like, again, back to the compassion piece, like we're all humans, right? And we're all tired, and we just need to be kind to each other, I think.
Ali, grab a microphone and
Yeah, so what we're seeing in our community with all the adults in the downtown core and the situations that are happening there, these are really young people who never had their mental health or substance use challenges really attended to. And so the hope that the Youth Hub brings, and also at Algoma Family Services, we have only 3 really youth addiction counselors, each carrying caseloads of over 50. It becomes challenging. And to your comment earlier about many on the front line being burnt out, we've been battling this for years. And so in answer to your question in terms of need, it is what we call that upstream investment into our young people. If we can get that, then some of the challenges that we're experiencing now may not be the case in even 5 years from now. If we can have the resources that we need to help young people learn more about what some of these challenges are, education around the community to better support and destigmatize. I think the simplification of this issue is that this is a choice. I don't know anyone who would choose to be homeless. I don't know anyone who would choose to be hungry. I don't know who would choose to be having to commit crime in order just to find the bare necessities that they need. Like, this is so much more complicated than that. But I actually feel that there is some hope with this Youth Hub, that we can have young people. I'll just give you a quick story. Before the Youth Hub opened, we had 3 young people on their bikes hanging out behind the hub before it even opened. And we were getting a lot of calls, and you will know that, from the businesses saying that, you know what, there's a lot of people using, we're concerned, we can't go to our cars and so forth. Well, since we've opened that hub, I actually haven't received any calls, and I was getting them with some regularity. So it is an example of where there is help, there can be change. But going back to those 3 young men, when I went back there, because there was a concern that, you know, what were they doing back there? So I went back there and talked to them, and I just asked them, hey, what's going on? And they just asked, what's going to happen with this building? And I told them that. But one of the young men said to me, you know what, I'm not in a really good place. And I'm too old to actually to benefit from what will happen at Youth Hub, but I have a little brother, and I don't want him to be where I am. And I'm really happy that a place like this is going to exist, because maybe my little brother can get the help that I didn't get. And he said, you know what, if you need help telling people about this place, I'll spread flyers, I'll tell everyone that I can about that. But it's an example of when we can help young people help others, I think there's going to be a great opportunity for change. We need to hear more stories about of the Emilys, those that have actually are in recovery, those who've been successful. Because too often our community only looks at this issue from a really negative perspective, and these stories aren't told. And that's why I'm so happy that you're here to help us share these stories, because people can see that there is hope and there is an opportunity for change.
Let me hear from Nathan, then Jake.
So, well, I totally agree that more people need to hear those stories. And Emily, like, I completely understand. I celebrated 12 years in February.
12 years.
12 years clean off stimulants and methamphetamines. And when I first was getting clean, and even to this day, I have employers who get worried about my sobriety. It's not necessarily a safe thing to come out and say, hey, you put a target on your back. It can make so that your children, the parents of your children's friends, don't want your kids hanging out because he was an addict or she was an addict, or
There's that stigma.
there's
again.
100% stigma. I've lost jobs over people. When I was 7 years clean, I lost a job because they found out that I was an addict. I was too much of a risk. So it's not necessarily like a safe thing to do, right? And
We love your guts, Nathan.
yeah, it's hard. Like I just want to. There's people in this community that they speak, and I just want to slap them in their mouth, because it's like you have no idea what it's like, and it's not a simple thing. Watching those people, like, I empathize. I know where they're at. I can get it because I've been there, and we need empathy. We need enough support to continue to be empathetic, to literally continue going when, like, that gray cloud's there and you just want to, like, bury your head in the sand. And we need people to actually understand, and we need people to realize, to have that hard talk about, like, that every single person here is addicted to something. Some of them are just a lot worse. And to take that into thought, like, go a day without coffee, like no caffeine in your system. Go 3 days and tell me how you feel. The moment you can drink that coffee, you're gonna be pounding it back. And to think about it that way, instead of it's just drugs and, just this, just that, realizing that everything you're doing, sorry, I'm gonna be driving a bus, but everything you're doing, every time you close that door, every time you push that person out, could be the last time that person's breathing. And 9 out of 10 times, in my experience, I can give you 9 people that would be complete respectful sitting inside your building. And we can't base our choices off of one person. Exactly. That young man behind that building who said, "I'm glad there's someone here for my little brother." That's someone who has forward thinking. And those are the things we have to look at. Like, yeah, there's bad people in the world, but they don't have to be doing drugs to be bad people.
In every walk,
Yeah.
there's bad people.
Let's do Jake here and then Hillary.
Just for my own education, the way the system is set up right now seems to be very reactionary. There is a problem and now we have to fix it. Where can we invest, if anybody can tell me, to eliminate the problem before it's a problem?
Upstream versus downstream solutions.
Yes.
For sure. Hillary, this one's in your
perfect.
wheelhouse.
That's
Yep.
what I was going to talk about. So, yeah, I think to your question about where do we go, and it's been brought up a few times. Ali was talking about upstream interventions. We were talking about different interventions that are needed, especially treatment. And one thing that's important that maybe we can think of are some interventions that are happening across the country right now, and we can take some lessons learned from decriminalization, safer opioid supply, because what's becoming clear is that those interventions in isolation don't work on their own. And it is across sectors, and it is across interdisciplinary teams, planning roadmaps for communities that encompass the continuum of care. And the continuum of care can be right from an early age. It can be parenting supports. It can be resilience and skill building in schools, all the way to acute care. So we need first responders. We need to have longitudinal care set up. So opioid agonist therapies and more prescribers that have that. Community-based care can include supervised consumption sites, housing, mental health services, and peer supports are also key across this continuum. And also at the individual level in the upstream way when we're thinking of children so young, against a backdrop of the traditional pillars that are known in substance use as harm reduction, prevention, treatment, community safety. And in recent years, those have blended together because they don't exist in isolation. So it is so complex and we need to all work together. And that's
Let's get Nick and then Sarah.
Thank you. So with that possible, maybe a roadmap to solutions and dealing with, reaction instead of being reactionary, being proactive. I know Canadian Urban Institute is doing some work in Ottawa right now for the downtown. And, one thing we don't really have here is a unifying plan across organizations and sectors, 1 to 5 years of what everybody's role is. We only have so many resources and we can't just depend on, levels of government to bail us out. Every town is looking for funding. And
although, it's kind of interesting. Mm-hmm. Doug Ford and Peter Bethlen-Falvey, the Premier and the Minister of Finance, just the other day had a news conference in which they somehow found $250 million to help the brewers break that master framework agreement and bring a liberalizing of sale. Like, I think apparently the money's there when you want to find it for something you think is important. And I just wonder how some of the people here react to that kind of development.
Sure. And I mean, whatever is transpiring behind the scenes, of course, but, we have to deal with these problems. Every community has to deal with it themselves, and if they want to be resilient and strong, they have to have safeguards in place and a plan in place, or else we have no direction and nobody knows what roles they're supposed to take in moving forward and being proactive.
Got it. Sarah, did you want to say something?
No, I'm good.
No?
I finally have nothing to say.
Okay. Emily, did you want it?
No, I was
No?
just passing it.
Okay, Mike.
The one thing that I do agree with you wholeheartedly that we need to stop just investing in emergency responses. That's all that we've been doing over the last 3 or 4 years, and we need to sit down. And quite frankly, I think the reason that we're doing that so frequently is we do not have time to actually plan long term. How do we get ahead of this? Because it's such an acute problem. But just a stat that I think just starts to highlight some of the challenges that are coming. Right now, we have approximately 1,700 childcare spaces in the community. There's 2,100 children waiting for a childcare spot. So there's more children waiting for a childcare space than there are that have access to that childcare center in our community right now. We need to start all the way upstream, early years. We know that the first 18 months of a child's brain development is critical for their future success. But for whatever reason, we're talking about interventions at 12 years old, 13, 14. I would argue that if we're really going to get serious about this as a community and as a society, we need to start making those early years investments really, really hard and show our children that we want to invest in them versus just give them a debt that they can never pay off through the deficits that we're accumulating over time and time again. And I agree with you. I'm starting to get a little bit passionate, but we do need to make demands from government that we expect more. It is our money. It is our government. Yeah. And I think until we start to tell them what we truly want, and I think everybody does want a solution to this crisis. The problem is we have no idea what that solution actually is.
Ali.
So it's a challenging question in terms of what the solution is, but I just want to go back to your comment about the investment in having alcohol and grocery stores, so forth. I mean, that is the number one substance for young people is alcohol, marijuana, and then nicotine. Like many will think it'll be some of the hardcore drugs, and there is use, but alcohol is the number one substance that young people are using. So it is interesting, the more availability that it has there, the more impact that it can certainly have in our community. But that wasn't really what I wanted to talk about. It's just, Jack, you talked about what can we do, and some of the thoughts, and I know Case has been a great support of the Hub in terms of donating instruments and so forth. Our hope is to give young people the opportunity who have mental health and substance use challenges, the opportunity to learn job readiness skills. They can get a resume, they learn how to do interviews, we have a kitchen, learn how to to prepare food so that they can be more ready for the workforce. There's nothing worse than when you get excited, you get your first job, and then you're fired after the first week because either your mental health challenge or your substance use challenge got in the way of that. That's so traumatic that many choose not to go back into it. Who would want to, right? But having this opportunity to have our young people be able then to branch out, maybe work in your shop, or work in some of the other businesses, or have those businesses come and help train some of our young people, can give them that opportunity. Nathan, you know, the idea that one day some of these youth could open their own store, their own business, and open it from their own lived experience, recognizing that, you know what, yeah, some people have some challenges and maybe we'll hire them or want to hire them because they have a better understanding than perhaps maybe the business owner that doesn't have that, is a tremendous opportunity that leaves us very excited. The last thing I wanted to say is that, you know, if we go back to the social determinants of health, and this is what Mike was talking about earlier, we can do all this great work in terms of treatment and providing support, but if these young people don't have anywhere to live, they're going to go back to the drug houses because it's the only warm and safe place, using a bathroom that's available to them, but it always comes with some conditions when they're there. And if we can have that housing for them, I think we can actually do better. But that, going back to your earlier question in terms of what can we do or what do we need, it's certainly supportive housing for young people.
Got it. Let's hear Amy, and then Emily, we're going to give you the last word.
We've been talking about a lot of great things that we can do in our community to help this issue, but I think one of the, it was talked about, but just being kind on an individual level to these people, that they are people, that they're somebody's child. I know for myself in recovery, when I was transitioning to getting clean, I felt like an outcast in this community, you know, and that made it so much harder to have hope in myself that I was gonna better my life because nobody else saw me that way, you know. So I think everything that we've been talking about is great, but the smallest things, like when somebody's standing out there, you know, say hello. You don't have to give them money, you don't have to do this, but treat them like a human being. And I think that's that's not happening a lot in our community. Working at the community resource center, we'll have people sitting out front. People will roll down their window just to scream terrible, terrible things at these people. You know, and they feel it, and they may use more because of it. They may, you know what I mean? It doesn't help anything.
Costs nothing to be kind.
Exactly.
Emily, wrap it up for us.
I just wanted to go back to the youth subject. I've been noticing a lot more lately that so many youth have been dying of overdoses. You know, they're smoking marijuana, drinking alcohol, doing cocaine, but all of that stuff is cut with fentanyl. And the fentanyl going right now, I hope everyone heeds this warning, isn't normal. I mean, it's being laced with something that is causing seizures, and Narcan isn't even working. It's extremely potent, and it's sad. So a lot of the youth ages 12 to 18 have been passing away in the past couple of months. I've been noticing. It's awful.
I can't. Listen. Did you want one last word? Is that why you're holding the microphone there?
Yes.
Okay. Why don't we give Soya the last word then?
I think we have a lot of great community services. I think we all have to unite. We all have to, there's a little group that's happening right now. I call it the White Castle group. I'm not saying whose name, but it's our head honchos that we get together. But we all need to work together. We all need to be kind. The stigma is not just in our city. I do get tired of people always it's Sault Ste. It's not just in our city. Okay. And then when it comes to your remark about the fentanyl, we need drug testing strips to test this crap. And we need stuff like that. It's a simple fix, a little funding. Let's get the little things that's going to save somebody's life, because I don't know one person that says, well, today I'm going to brush my teeth, I'm going to have a shower, and I'm going to become an addict. But thanks for coming.
I just want to say finally how grateful I am to all of you. I have no doubt if we put you 13 in a room for long enough, you would all come up with a solution here and solve this issue. You're brilliant and talented and very generous to spend so much of your time with us. We said this at the beginning, but it bears repeating. This conversation is happening in Sault Ste. Marie. It could happen anywhere in the province of Ontario today. We'd be having a similar conversation. So we're grateful. Thank you all so much for joining us today.
TVO Today Live is made possible by the generous support of the Wilson Foundation.